Let's discuss glaucoma now. Glaucoma is when there's too much pressure in your eye and it's starting to affect your optic nerve. Interesting enough, your optic nerve feeds behind your eye into your eyeball, but when there's too much pressure, it starts getting squished. And just like if I squish my finger, it's not getting oxygen and nutrients, and so it starts dying. It starts not working very well. So just like if I squish my finger long enough, it's not going to be able to function as well because it's become hypoxic. There's not going to be enough oxygen. So once again, you want to avoid having excess eye pressure. There's a couple kinds of eye glaucomas. There's closed angle and open angle. We'll discuss that in a moment. But the reality is you have to keep your eye pressure low. I encourage everybody once a year, go get your eye pressure measured at an eye doctor. It's critical. If you have any visual changes, you notice halos around your eyes, you need to get in right away. So if you're looking at a street light and you see a halo, or you're starting to get eye pain, you need to go in right away. If you start seeing flashes in your eyes, you need to go in right away because sometimes closed angle can be called acute, which means urgent or rapid onset, and you only have a small little window of time to lower that pressure before the visual changes and potential blindness is immediate. So that's not a scary thing. That's just listen to your body. Just like if you're having chest pain, you'd go in and get that checked out. If your finger hurt really bad, you'd go get that checked out. I have a saying that I've came up with over the course of many years now of when do you want to become a patient, and I call them the P's. If something persists, if something progresses, or if something is pronounced, then you become a patient. So once again, persistent, so you have a condition, it's not getting better. Progressive, it's getting worse. Or one morning you wake up and say, wow, that's kind of weird. I've never noticed that before. You want to get it checked out and become a patient. Those 3 P's are a great guideline of listening to your body. Remember, you're made of 75 trillion cells. Your body has a dynamic capacity far beyond anything we currently know about in medicine. But the fact is, you are the master. You've lived in your body. You know what's normal, what's not normal, and you actually may be better at describing what's going on than the doctor's tests. So combine that knowledge and don't be bashful and tell your doctors. So an ocular pressure should be between about 10 and 21, and ideally a little lower than that. If that pressure goes higher than that, you need to take charge and figure out what's going on. Closed angled is when there's a physical blockage and your eyeball is not able to drain the aqueous fluids out and the pressure builds up like a balloon. Open angled is a little different. The drainage still remains, yet there's still excess pressure. And we need to figure out what's going on in both cases. A good eye exam can do that. They'll dilate your eyes typically and see how do things look in the back, is there a blockage, and what's causing the blockage. So acute angled is, of course, more problematic because it's rapid onset, pressure builds up too quickly, and of course then you can actually end up with severe problems that can be permanent. But regardless, long-term increased eye pressure, once again, squishes the optic nerve, as a result causes damage. And because you get ischemic, which means you don't have enough oxygen to the other tissues, you end up with big, big problems. There's several things that can be done for glaucoma. They include bilberry. They include vitamin A and vitamin E and vitamin C. They also include, and I'll go over all these slower in a moment, magnesium and bioflavonoids, ginkgo. There's quite a bit of research on eye health and natural ways in which you can support lower pressure. I've had patients, both happen to have been women, with very high eye pressures. And as a result, we've actually given them some natural things, had the privilege and opportunity in these 2 positive cases to see the pressures lower naturally to normal levels. Sometimes, however, you'll need to do eye drops or other medications to lower your blood pressure. But even when you're doing those things, you still want to support the nerves. Bilberry, of course, coleus, melatonin. You say, but isn't melatonin for sleep? But melatonin has actually been shown to help also with glaucoma. So let's look at each one of these individually for a moment here. Vitamin C and E, antioxidants, water-soluble, fat-soluble, important for protecting the nerves and the tissues in the eye and the connectiveness. Also, lipoic acid. Alpha-lipoic acid has been researched a lot for nerve problems. Remember, the optic nerve is what's being squished. Alpha-lipoic acid can help support and nourish that nerve. So can B vitamins. So increasing your B vitamins and your alpha-lipoic acid can help a lot. In addition, magnesium relaxes. Remember, like with blood pressure, calcium contracts, magnesium relaxes. You want to relax the tone of all the other tissues around there. Magnesium can be helpful. Likewise, coleus can do the same thing, help with relaxing the pressure a little bit in many cases. Once again, in the case of glaucoma, it's a serious condition. You're going to want to work with your doctor. It's not something you just want to venture on. And you're going to want to be monitored every 3 months minimally to see, is that eye pressure getting better? After all, you are fighting for your eye health. But even with medications, you still want to support them, in my mind, once again, talk to your doctor, B vitamins, lipoic acid, magnesium, and antioxidants, things like ginkgo and bioflavonoids to support the integrity of your eye. Your eye, of course, is the window out into the outside world. So supporting that's important. Too many people every year go blind from untreated eye conditions. So taking charge is so essential. And I encourage you, work with your doctor, go in once a year, and take charge of your eye health. We take our hearts for granted. We take so many other things for granted. We cannot take our vision for granted, because you close your eyes for a second and you're saying, I don't like seeing that. Or you squint your eyes, or let alone you put some Vaseline on your glasses. They say sunglasses, eyeglasses, put some Vaseline and imagine seeing the world that way. You don't want to see that. So any visual changes, don't ignore them. Take charge, go see your doctor, and realize if you nourish your body, all things being equal, your body will work for you as well.